Dear students, welcome to you all today's pathology session. I am Dr. Asma Hosna, Associate Professor, Department of Pathology, Bashundhara Ad-din Medical College. Today I am going to discuss the topics about the disease of ovary. The disease of ovary includes inflammation, endometriosis, ectopic pregnancy, cyst and tumor. At first, the cyst of the ovary. The cyst of the ovary includes either non-neoplastic cyst or neoplastic cyst. And the non-neoplastic cyst include physiological cyst, that may be follicular cyst and luteal cyst. And the pathological cyst include ovarian endometriosis and polycystic ovarian disease. The ovarian endometriosis, also known as chocolate cyst. You know, when there are presence of endometrial tissue, that means endometrial gland or endometrial stroma within the ovary, it is known as ovarian endometriosis or chocolate cyst. And the neoplastic cyst include cyst adenoma, cyst adenocarcinoma, dermoid cyst, etc. Now, what is polycystic ovarian disease? The polycystic ovarian syndromes is a complex endocrine disorder, and that is characterized by hyperandrogenism, menstrual abnormalities, polycystic ovaries, chronic anovulation and decreased fertility. And there are presence of multiple cysts within the ovary, and so it is called polycystic ovarian disease. And the patient may develop infertility, oligomenorrhea or amenorrhea, hirsutism, virilism and obesity. And during microscopic examination, we will find presence of multiple cysts, and there are also cortex of the ovary is very thick. Now, come to the tumor of the ovary. The WHO classification or ovarian neoplasm are classified in the following category. At first, there are surface epithelial stromal tumor. It include serous tumor, and this serous tumor may be benign. When it is benign, it is called either cyst adenoma or cyst adenofibroma. It may be borderline, then it is called serous borderline tumor. It may be malignant, either low or high grade serous adenocarcinoma. Then mucinous tumor, it may be benign, it may be borderline or malignant. When it is benign, it is known as cyst adenoma, cyst adenofibroma. In case of borderline, it is called mucinous borderline tumor, and when it is malignant, it is called mucinous adenocarcinoma. Then endometrioid tumor, it also may be benign, called cyst adenoma, cyst adenofibroma, may be borderline, called endometrioid borderline tumor, or malignant, then it is called endometrioid adenocarcinoma. Then clear cell tumor, it also can classified into benign, borderline or malignant clear cell adenocarcinoma. Then transitional cell tumor, it also can classified into benign Brenner tumor of borderline malignancy and malignant Brenner tumor. And the epithelial stromal tumor also classified into adenosarcoma and malignant mixed Mullerian tumor. All of these are the surface epithelial tumor. Now, the 6-cord stromal tumor. The 6-cord stromal tumor can also classified into granulosa tumor, fibroma, fibrothecoma, thecoma, sartorilytic cell tumor and steroid cell tumor. Then the germ cell tumor. The germ cell tumor are classified into teratoma, dysgerminoma, yolk sac tumor and mixed germ cell tumor. And the teratoma also classified into either immature or mature solid cystic teratoma or monodermal teratoma. And lastly, the metastatic cancer from non-ovarian the primary site, that may be colonic, appendiceal, gastric, pancreatobiliary or breast. Now come what is serous tumor. These are the cystic neoplasm that include the most common malignant ovarian tumor and account for approximately 40% of all cancer of the ovary. And it occurs between 20 to 40 years of age. And this is called serous because of the presence of cystic fluid within the cyst. And it has become synonymous with the tuber-like epithelium in this tumor. This serous tumor classified into 3 categories, that is benign. When it is benign, it is called serous cyst adenoma. It may be borderline tumor or malignant tumor. When it is malignant, it is known as serous cyst adenocarcinoma. And clinically, these serous tumors are present bilaterally, and it occurring in 20% of benign serous cyst adenoma. In 30% cases, it may be serous borderline tumor, and approximately 66% cases, it may be serous carcinoma. Then come to the gross examination. In case of serous tumor, it may be present as a multicystic lesion in which the papillary epithelium is contained within fibrous wall cyst, that is intracystic, or as a mass that projecting from the ovarian surface. Benign tumor typically have a smooth glistening cyst wall with no epithelial thickening or with small papillary projections. In case of borderline tumor, it contains an increased number of papillary projection. And in case of malignancy, the tumor may be present with large area of solid or papillary growth, and there are also presence of tumor irregularity and fixation or nodularity of the capsule with the structure. Now come to the microscopic examination. Microscopically, the cyst wall are lined by columnar epithelium. In case of benign tumor, the epithelial cells retain abundant cilia and microscopic papilla may be found. In serous borderline tumor, there are increased complexity of the stromal papilla and also stratification of the epithelium, and mild nuclear atypia also present, but there are no invasion to the stroma. So this is called serous borderline tumor. But in case of malignancy, in high grade serous carcinoma, they have more complex growth pattern and widespread infiltration or frank effacement of the underlying stroma. That means there are stratification, nuclear atypia, and also there are invasion of the tumor cell to the stroma. And the individual tumor cells display marked nuclear atypia, including pleomorphism, atypical mitotic figures, and multinucleation. And occasionally the tumors may be so undifferentiated that serous surfaces are no longer recognizable. That's all about student lecture. My dear student, see you again in our next class. Till then, Allah Hafiz.